In this video, we'll be studying about some of the named signs in ENT. I am Dr. Sana Datta, MS ENT. Now let's begin. Coming on to the Aquino sign. In this, there's blanching of the tympanic mass on gentle pressure on the carotid artery seen in glomus tumors. Battle sign, there is bruising at the mastoid region and middle cranial fossa fractures. Boca sign, absence of laryngeal crepitus in posterior cricoid malignancy, which are known as Moore's crackle. Boy's sign, a gurgling sound due to noise of splashing fluid accumulated in large Zenker's diverticulum can be heard on palpation. This is the battle sign, where we can appreciate the bruising over the mastoid region. And this is the boy's sign, and this is the large Zenker's diverticulum. Brown sign seen in glomus tumor, blanching of the mass on applying positive pressure with Siegel's speculum. Bryce sign, combined laryngocele and external laryngocele. Compression will cause a hissing sound as the air escapes from it into the larynx. Delta sign is seen in lateral sinus thrombosis. CT or MRI with contrast shows an empty triangle appearance of the thrombosed sinus surrounded by contrast enhanced dura, which is known as empty triangle sign, and this is the delta sign. Dot sign, crescent of air between mass and posterior pharyngeal wall is seen on lateral X-ray. It is positive in AC polyp and negative in GNA, also known as crescent sign. This is the dot sign, in which we can appreciate a column of air between the back of the mass and the posterior pharyngeal wall. It is positive in AC polyps. Furstenberg sign seen in cephaloceles, pulsation and expansion of the mass with crying, straining or compression of the jugular vein. Geisinger sign in lateral sinus thrombosis. There is spitting edema seen over mastoid, process due to thrombosis of the mastoid emissary veins. Gutzman pressure test seen in puberphonia, where external downward pressure on the thyroid cartilage evokes a normal sounding voice. Halo sign, also known as target sign or double ring sign, is seen in traumatic CSF leaks due to blood mixed with CSF, seen in cases of CSF rhinorrhea. This is the halo sign. Holman-Miller sign is seen in cases of GNA, where there is anterior bowing of the posterior wall of the maxillary antrum. This is the Holman-Miller sign, where we can appreciate the anterior bowing of the posterior wall of the maxillary sinus. Henneberg sign is false positive fistula test seen in cases of congenital syphilis and Meniere's disease. Hitzelberger sign is seen in acoustic neuroma, hypoesthesia of the posterior wall of EAC due to involvement of the cranial nerve 7 sensory fibers by the growing tumor. Coming on to the Horndusa sign, which is seen in GNA, there is widening of the gap between maxillary body and the ramus of mandible. Irwin-Moore sign is seen in cases of chronic tonsillitis, where the pressure on anterior pillar pus comes out, positive squeeze test. Lighthouse sign is seen ASOM cases, small pinhole perforation with pulsatile discharge, stage of separation of otitis media. Another sign is cartwheel sign, seen in cases of ASOM only. This is the cartwheel sign, where congested membrane with prominent blood vessels are appreciated, seen in early stages of otitis media. Coming on to Lyre's sign, seen in carotid body tumor, where there is splaying of carotid vessels at the junction of external and internal carotid artery. Now, lyre is such a musical instrument, and this is the Lyre sign. Omega sign is seen in laryngomalacia cases. Paracusis villi in otosclerosis, patient hears better in noisy environment than in quiet environment, as the person has to raise his voice in a noisy environment. This is the omega shaped epiglottis. Phelps sign in glomus jugulaire refers to erosion of the crest of bone between carotid canal and jugular foramen, carotico-jugular spine. Reservoir sign in acute mastocytitis cases, where the ear canal fills immediately with pus or fluid after being cleaned. Rising sun sign, a red vascular hue behind intact tympanic membrane, seen in glomus tumor, high jugular bulb, aberrant carotid artery in the floor of middle ear. This is the rising sun sign. Steeple sign, narrowing of the subglottic airway, seen in croup or laryngotracheobronchitis. This is the steeple sign. We can appreciate the narrowing of the airway. Schwartz sign or flamingo flush, seen in cases of otosclerosis due to increased vascularity in the submucous layer of promontory. This is the Schwartz sign. Stankiewicz sign, application of pressure over orbit externally causes herniation of orbital fat into the nasal cavity in cases of injury of lamina pepperetia. This is the Stankiewicz sign, where we can appreciate external pressure over the orbit is causing the orbital fat to herniate into the nasal cavity, which is then seen with nasal endoscopy. Teardrop sign, seen in orbital floor fractures. Teardrop shape of opacification seen hanging from the roof of maxillary sinus on Waters view X-ray. Teardrop represents herniated orbital contents, periorbital fat and inferior rectus muscle. Thumb sign is seen in cases of epiglottitis. Thumb-like impression is seen on X-ray. This is the teardrop sign, and this is the thumb sign in epiglottitis. Tripod sign is acute epiglottitis in children sitting and forward bending to have easy breathing. This is the tripod position. Tullio's phenomena is loud sounds causing vertigo, typically seen in superior semicircular canal dehiscence. Tumarkin otolithic crisis, also known as drop attacks, there's sudden fall without loss of consciousness, seen in cases of Meniere's disease. Ramharan sign, seen in JNA, there's widening of the pterygoid wedge in pre-op CT. Chopstick sign, seen in JNA, after drilling of the pterygoid wedge, appearance of two pterygoid plates on post-op CT as two parallel lines. Now, coming on to some eponymous signs of thyroid ophthalmopathy. Dalrymple sign is lid retraction. Von Graafe sign is lid lag of upper eyelid on downward gaze. Rosenbach sign is fine tremor of eyelids when closed. Gifford sign is difficulty in everting upper lid. Enroth sign is edema of lower lid. Selvach sign is incomplete and infrequent blinking causing a staring look. Geoffroy sign is absent creases on the forehead in superior gaze. Mobius sign is inability to converge. That is all in this video. I'll be seeing you in my next video. Thank you so much for watching. Please like, comment and subscribe to my channel.